A recent study shows 35% of U.S. adults go online to look up a medical condition.
But turning to Google when you're sick may not be the best option.
Tonight in a special report, News 13's Megan Shearing examines the dangers of self-diagnosis.
When you feel sick or notice something isn't right, you can sometimes turn to the internet. There are several medical websites that may help you figure out what's going on with your body.
Yeah, I see about it every day. We see somebody who thinks they have something and they've researched it on the internet or other places.
So we'll just start in your scalp if there's any moles that you know of.
Doctors at Forest Dermatology in Asheville say it's helpful when a patient does do their research before coming in for a visit.
Because patients do have an idea of what kind of questions they need to ask if they've gone to a reputable website.
In Kay and Fred Cooke's case, WebMD saved Fred's life.
I was already out of bed and I was getting ready to go to an exercise class. And he came to me and he said, I have this excruciating pain kind of in my back and wrapping around my side to my chest. He said, and I coughed up blood, and not a lot, but a little bit.
Kay says she turned to the medical website for help. It diagnosed Fred with a pulmonary embolism.
And at the very bottom it said, this is an emergency situation. A doctor's office can't help you. This person needs to go to the emergency room. So I flicked off my computer and said, won't be going to exercise today. Get in the car. We're going to the emergency room.
But at the ER, doctors first diagnosed him with pneumonia.
I said, you know, I have to just tell you, I'm a little concerned that it's not pneumonia because he hadn't had any like cold symptoms. I always thought you had to get a cold, sniffles kind of that went into pneumonia.
Kay convinced the doctor to run more tests, and they show WebMD was actually right.
WebMD played a certain critical role in saving my life, absolutely, no question about it.
It gave me the knowledge to be able to speak up to a doctor who I always like try to have. I have a great deal of respect for him, but in this one instance, I just thought I don't think that's right.
Pew Research found that 1/3 of adults in the U.S. use sites like WebMD to look up a medical condition. 46% of those who said they went online say what they found led them to believe they needed help from a medical professional.
Nowadays, I think it is more common, though, because we're getting a lot of useful health information online.
Dr. Amy Parrish is a clinical psychologist. She says there could be a normal range of self-diagnosing, but she has seen some people take it to the extreme.
People will, be afraid to go out, be afraid to participate in their life, spend a lot of their free time checking and rechecking on the internet trying to find a diagnosis.
Dr. Parrish says the act of constant symptom checking can possibly trigger other medical issues, especially when you're clicking on untrustworthy websites.
For some people, it becomes almost an obsessive compulsive disorder. They become very self-focused on their symptoms, and checking, the obsession is, oh my God, there's something wrong with me. The compulsion is in getting on the internet and checking to see if they can diagnose what is wrong with them. They don't find a lot of information to calm their fears. It actually makes them more anxious.
Doctors admit that another reason some people self-diagnose is because they can't afford to visit the doctor or can't get a timely appointment. So they do agree there are some practical aspects of turning to the internet. Now, we've put a few reputable medical sites on our website. Go to WLOS.com and click on more info. Back to you.